You know, in healthcare, you might think the most powerful tools are things like scalpels or high-tech machines. But what if I told you some of the most powerful tools are just words? It's true. But how do we actually use them to heal, to connect, and even prevent real harm? Well, that's what we're going to demystify today. The art of connecting through what we say. Okay, let's start with a really big number, 250,000. A study back in 2016 found that this is the staggering number of people who die in the US every year from medical mistakes. I mean, think about that. That makes medical errors the third leading cause of death, right behind heart disease and cancer. It's, it's a really tough statistic to hear. But you might be wondering, what on earth does this have to do with communication? Well, it turns out it has everything to do with it. Because a whopping 30% of all malpractice claims come directly from a failure in communication. We're talking about $1.7 billion lost, and even more importantly, over 1,700 deaths a year that could have been prevented. This isn't about getting a super complex surgery wrong. A lot of the time, it comes down to the very basic human act of talking and listening. So, here's how we're going to break this all down today. First, we'll talk about the high stakes of silence. Then, we'll get into decoding the message. After that, we'll see communication in action, explore the digital bedside, and finally, we'll test your technique. All right, first up, let's tackle what might be the biggest hurdle for anyone really, whether you're a student or a seasoned pro, and that's the fear. The fear of saying the wrong thing. It's this fear that can just make you clam up, right, when someone needs you to connect the most. And this right here is so important to remember. You're gonna worry you'll say the wrong thing, but here's the secret. Patients can tell when you're trying. They appreciate a real person who shows genuine acceptance, respect, and concern way more than someone who has a perfect robotic script. It's not about being flawless. It's about being present and meaning well. Okay, so if we're going to get good at this, we really have to understand what communication even is, because it's way more than just the words we say, right? Let's use a little mental model here to peel back the layers and see what's going on underneath. This is something called the transactional model. And honestly, the best way to think about it is not as a one-way street, where one person talks and the other listens. It's more like a game of catch, a really fast one. Both people are sending and receiving information at the same time. Words, tone of voice, body language, it's a constant back and forth dance. And just like any game, there are a few key parts. You've got the communicators, that's you and the other person, both sending and receiving. You've got the message, which is the what. You have the channel, which is the how. Are you face-to-face, on the phone? And then you've got noise. And noise can be anything that gets in the way. It could be a loud TV, sure, but it could also be a nagging headache, or just you worrying about what to say next. Now let's zoom in on the message itself, because it's got two really distinct parts. First, there's the verbal part, the content. These are the actual words you speak. You can think of this as your public self. But then there's the nonverbal part, the process. This is your tone, your posture, your gestures, and this often reveals your private self, what you're really feeling. And this is where things can get super confusing. It's when your words, your public self, say one thing, but your body language, your private self, is screaming something totally different. That's what we call an incongruent message. It's a mismatch, and it's basically a recipe for misunderstanding, and, you guessed it, a total breakdown of trust. There's a really specific and pretty damaging version of this called a double-bind message. This happens when someone with some power over you sends two messages that completely contradict each other. It basically traps you in a no-win situation. And this example, wow, it just paints the perfect picture. Just imagine a mother saying this to her daughter. The words, the content are, "Oh, go ahead, have fun." But look at the rest of it. The sad expression, the slumped posture, the process is shouting, "You're abandoning me and I'm sick." It's a total trap. If the daughter goes out, she's racked with guilt. If she stays home, she's technically ignoring her mom's request. There's no right answer. So yeah, that is a classic no-win situation. It's a complete mess of mixed messages. So the big question for us is, how can we use our communication skills to untangle these knots instead of tying them? Which brings us perfectly to our next section, communication in action. We're moving from the what to the how. These are the actual tools and techniques you can start using right away to build that trust and offer real support. Take a look at this exchange. So simple, but so powerful. The patient shares this incredibly painful moment. And the student's response? They simply say, "You felt like you couldn't go on." That's it. It's a technique called restating, and it does something amazing. It tells the patient, "I hear you. I'm with you." It validates their feeling without jumping in to fix it or give advice. A lot of this really comes down to swapping out our natural habits for something a bit more thoughtful. So instead of jumping in with advice, try exploring options with them. Ask something like, "What have you thought about doing?" Instead of asking a why question, which can honestly make people feel defensive, try encouraging them to just describe what happened. Say, "Tell me more about that." And please, instead of saying things like "don't worry" that minimize their feelings, try to empathize. That must be so upsetting. It makes a world of difference. Of course, these days, the bedside isn't always a physical place, right? Communication isn't just happening face to face anymore. Technology has completely changed the game in terms of how, when, and where we all connect. I mean, look at the rise of telehealth. It's become a huge part of healthcare, using video calls, the internet, you name it, to connect doctors and patients. This is incredible for people in rural areas or people who are homebound. It just eliminates those physical barriers. And for mental health support, it can be a total game changer, helping to reduce that stigma and just making it easier to reach out. And it's not just appointments. We've got mobile apps putting therapeutic tools right in our pockets. In the US, for example, organizations like SAMHSA have apps for suicide prevention, anti-bullying, all sorts of things right on your phone. This is a whole new world of support, and it's there for you 24/7. All right, we've gone over the theory, we've looked at the tools, now it's time to put it all into practice. Let's test your technique. I'm going to give you a couple of real-world scenarios, and let's see how you'd handle them. Okay, first scenario. Picture this. A patient comes to you and they're really anxious. They tell you, "Last night, demons came to my room." Now, you know this isn't real, but you can't just argue with them, and you definitely can't agree with them. So, what's the right thing to say here? The best response is to focus on the one thing that is absolutely 100% real in that room: the patient's feeling, their fear. You say something like, "You seem upset. Please tell me more about what you experienced." See what that does? It validates their emotion, the fear, without validating the hallucination itself. You're not confirming or denying anything. You're just opening a door to talk. Okay, on to scenario number 2. This one brings us right back to that classic mismatch we talked about, the incongruent message. A patient tells you he's really looking forward to something, but he's frowning. He's not making eye contact. His words say one thing, but his body is saying the exact opposite. So how do you bring that up without sounding like you're accusing him? The best way to handle this is to just be an observer. You can gently say, "You say you look forward to the meeting, but you appear anxious or unhappy. You're just stating what you see. It's not an accusation at all. It's an invitation. You're giving them an opening, a safe way to talk about the real feelings that their body is already showing." So as we've seen, this isn't just about being nice. Good communication is literally the foundation for safety, trust, and healing. So here's my challenge to you. As you go about your day, think about this. What's just one conversation with a patient, a coworker, a family member that you can make a little bit better using these skills? Thanks so much for joining me.